Welcome back to your lab companion. In part one, we explored the hormonal blood test for thyroid, PCOS, and female reproductive health. But today, we're diving into something just as critical, but often misunderstood: male hormones, stress hormones, and the hidden world of insulin and metabolic balance. Whether you're a student, a lab professional, or just someone decoding your lab reports, this video will give you clarity, confidence, and real understanding. Let's begin. Male hormones. 1. Testosterone, total and free. Testosterone is the primary male sex hormone. It plays a crucial role in muscle growth, libido, bone strength, energy, mood, and even memory. Total testosterone measures all the testosterone in the blood, bound plus free, normal range, approximately 300 to 1,000 nanograms per deciliter. Low levels may indicate hypogonadism, pituitary issues, or aging. Free testosterone represents 1 to 3% of the testosterone that's not bound to SHBG. More biologically active, low free T can exist even if total T is normal. Causes of low testosterone: primary hypogonadism, testicular failure; secondary hypogonadism, pituitary dysfunction; obesity, chronic illness, medications, diabetes. LH, luteinizing hormone, secreted by the pituitary gland, stimulates Leydig cells in testes to produce testosterone. Normal, 1.5 to 9.3 international units per liter. High luteinizing hormone plus low testosterone equals primary hypogonadism. Low luteinizing hormone plus low testosterone equals secondary hypogonadism, pituitary issue. FSH, follicle-stimulating hormone, stimulates sperm production in seminiferous tubules. Important in fertility evaluation. Normal, 1.4 to 18.1 international units per liter. Elevated levels equals testicular damage. Low levels equals pituitary suppression or anabolic steroid use. Prolactin, often overlooked in men. High prolactin suppresses LH and FSH, lowers testosterone. Causes: pituitary tumor, prolactinoma, stress medications, e.g. antipsychotics. Symptoms: fatigue, low libido, erectile dysfunction, infertility. Case: a 35-year-old man with fatigue and decreased muscle mass might have low testosterone. A full panel reveals low T, high prolactin, suspect pituitary adenoma. Stress hormones. Cortisol is your body's main stress hormone. It rises during stress, regulates metabolism, controls blood sugar, and reduces inflammation. Morning cortisol serum, collected at 8 a.m., normal 6 to 23 micrograms per deciliter. Low, suspect adrenal insufficiency, Addison's. High could indicate Cushing's syndrome, stress, or steroid use. Midnight cortisol, serum, saliva, should be very low at night. If still high, loss of diurnal rhythm possible. Cushing's ACTH, adrenocorticotropic hormone, secreted by the pituitary, stimulates adrenal glands to release cortisol, helps differentiate causes of cortisol imbalance. Interpretation examples: cortisol ACTH, possible diagnosis: low-high Addison's disease, high-high Cushing's disease, pituitary tumor, high-low adrenal tumor or steroid use, special tests for Cushing's or Addison's, dexamethasone suppression test, ACTH stimulation test, 24-hour urine-free cortisol, salivary cortisol. Insulin and metabolic hormones. Insulin is the hormone that regulates blood sugar. Too little equals diabetes. Too much equals insulin resistance and weight gain. Fasting insulin test. Normal 2 to 20 UIU per milliliter. High levels with normal glucose equals insulin resistance. Seen in prediabetes, PCOS, obesity, metabolic syndrome. C-Peptide, secreted in equal amounts with insulin, Helps determine if insulin is coming from pancreas or injections. Low C-peptide plus high insulin equals exogenous insulin dash. High C-peptide equals overproduction of insulin, e.g. insulinoma or IR HOMA-IR, homeostatic model assessment of insulin resistance. Formula, greater than fasting insulin, UIU per milliliter, times fasting glucose, milligrams per deciliter, divided by 405. Example, 10 times 100 divided by 405 equals 2.47. HOMA-IR less than 1 equals very insulin sensitive. HOMA-IR greater than 2.5 to 3 equals insulin resistance case. Example, a 29-year-old male with fatigue, weight gain, and dark skin around neck, acanthosis nigricans. Fasting glucose equals 98. Fasting insulin equals 21. HOMA-IR, 5, strong insulin resistance. Hormones don't just belong to textbooks. They're alive inside you, shaping your energy, weight, fertility, and stress. Today you'll learn about testosterone, LH, FSH, and prolactin cortisol, and ACTH insulin, C-Peptide, and HOMA-IR. Save this video. Share it with your classmates or patients, and subscribe to your lab companion for more clear, trustworthy explanations of medical lab tests. See you in the next video.